Good morning, everyone. Good afternoon and good evening, wherever you may be hailing from. It's great to see so many of you here today, and thank you for taking the time to join us. And welcome to our latest Planetary Health webinar. Today's session focuses specifically on the Americas, and we'll be talking about environmental justice and Indigenous knowledge. One of the things I enjoy most of this webinar series is the opportunity to hear different perspectives from around the world. Today is no exception. We'll be hearing about the experiences, challenges, and leadership emerging from across the Americas and reflecting on diverse approaches to caring for both people and the environment. Whether you're joining us to learn something new, share ideas, or simply listen, I hope you'll find today's discussion inspiring and thought-provoking. A big thank you to our speakers for being with us and for sharing their expertise. We really are looking forward to the conversation. I'll now hand over to Harriet to get us started today and share where the inspiration for this series came from.
Thank you very much, Stefan, and thank you very much, everyone, for joining this webinar. It's really an amazing time for us to meet on such an important discussion. My name is Harriet Naiga. I am a midwife and a specialist in sexual and reproductive health policy and programming from Uganda. I'm the founding director of Midwife-Led Community Transformation, MILCOT, which is a community-based organization that brings midwifery services closer to the community through preventive initiatives, and we focus on prevention of teenage and unplanned pregnancies. I'm also a champion of Nursing Now Challenge, as I have been empowered by Nursing Now Challenge from way back till now. As I work within the communities, I realized that we cannot work while excluding the impact of climate change in our work. I realized that marginalized adolescents and young adults are the ones that are facing the impact of climate change, especially around Kampala city in Uganda. Well, I got the inspiration when I noticed that there is an issue, especially around the use of plastic bags. And while in our city, Kampala here, the communities are not sensitized about the dangers of plastic bags. And yet, they are mostly used by the informal sectors. And the challenges we have faced is that they're being used and being dumped everywhere almost. And when the rain comes, they tend to block the drainage channels, and we see flooding in many places of the city. And because of flooding, we have seen a lot of cases, especially the waterborne diseases. The women I take care of, the children who report to our clinic, it's called Milcot General Clinic that we established in partnership with Vaca Health Foundation. And this is where I am working. And I receive these women with diarrheal diseases, children with malaria in the city here. And they have no knowledge about climate change. And my position as a midwife, I feel that I am strategically positioned to educate the community about the dangers or the impact of climate change, because the communities are the ones that are involved in the destructive activities. But then who is there to give them the preventive information? So I realized that the work of a midwife is very critical in climate change. So I provide information on how to use paper bags instead of plastic bags. What I do, I trained my team in the facility to make our own paper bags to pack the medicines, but as well as teaching the community how to utilize paper bags instead of plastic bags. I feel that this is something that is making a lot of impact because the community has now known why we have to use paper bags. But then when I realized that nurses and midwives are on the front line of care, not only in my community, but everywhere, depending on the climate challenges that we face in different areas. So where are the midwives placed? Nurses and midwives are placed in health facilities, in communities, and others are already doing amazing work in tackling climate change. However, we have not yet been seen enough. Our advocacy has not yet come out enough. And this is the time I felt that we need to speak to the world. We need to speak to the global stakeholders. We need support. So this is the birth of this Planetary Health series. And I'm feeling so humbled that we are having amazing speakers from yet another session, the Americas region. And we can't wait to hear from you. Thank you so much for joining us. The African region, our discussion was amazing. It opened our eyes. It opened the eyes of many nurses and midwives according to the feedback that we got. And we can't wait to hear from you all. Thank you very much. And I want to wish everyone a very, very fruitful discussion today.
Thank you so much, Harriet. We're so impressed by your inspiring work in midwifery and climate change. Thank you so much. Next on our panel today will be our keynote, Planetary Health and Environmental Justice in the Americas, Dr. Teddy Potter.
Hello, everyone from the Americas and beyond. Harriet mentioned about feeling humbled. I feel humbled to be in the midst of all of these folks that are speaking today, but especially in the presence of Harriet, who had an idea, a vision for improving the health of all people and brought this idea forward. So thank you, Harriet. We would not be here if it weren't for you. So I have 15 minutes to talk to you about sort of the foundation ideas of planetary health. All of these, just so you know, you don't have to take screenshots, you don't have to rapidly take notes. I have made it possible to have a PDF of the slides afterwards. So you can have those for your use. You can sit back and listen. The humans are changing the earth in many, many different ways right now. And climate change is just one of those. In some fields, we say that we are changing everything. It's not just climate change, it's changing everything. In fact, the United Nations calls it the triple planetary crisis, in which we are having climate change, we're having pollution of our soil, air, and water, and we're having biodiversity loss all at the same time. But as you can see from this list, it is looking different in many, many different places. And in this year of El Nino, we're seeing some places with massive flooding, other places with massive droughts and wildfires, and it's harming the health of all people. So nurses and midwives have got to be mobilized. We look at the 9 planetary boundaries. And the planetary boundaries, it's important to understand that science. The Earth operates like a living organic system, and it has 9 systems in order to stay healthy and functional and a place where life can thrive. 9 different systems, including the balance of the climate, biosphere or biodiversity, land use, water use, the quality of our oceans not being overly acidic. Um, uh, we shouldn't be adding in chemicals into our atmosphere. So there's these 9 systems. If we breach or break the 9 systems, it's very, very difficult for the planet to support life as we know it. I want to draw your attention to a couple things. One was last year we breached our seventh boundary. So, 7 out of the 9 boundaries that support life on the planet have been broken or are disrupted in very, very dangerous ways. And this is humans doing this. They're not natural changes over time, they're not a natural part of the ecosystem. It's human caused problems. But I want you to look at these 2 gray dots and hold this in your mind. The ozone layer was once exceeded, and that has been repaired. And similarly, we've been able to look at our air pollution. And in many respects, because of our laws and our policies, we've been able to reverse the severe, severe episodes of air pollution. So I want to leave you with that, a note of hope that when we get busy and we roll up our sleeves and work together, amazing things are possible. Now, a lot of nurses and health professionals might say, what does this have to do with me? I'm concerned about the patients and caring for people in a hospital or a clinic. It has everything to do with you because look at this. Those 9 boundaries, when they are breached, escalate cardiovascular problems, respiratory problems, zoonotic diseases, including pandemics, antimicrobial resistance, heat strokes, mental health impacts, malnutrition. Migration is an issue related to these 9 boundaries, and civil strife and trauma. And we know that domestic abuse also increases when the weather gets exceedingly hot. So all of this is nursing. All of this is essential for us to be involved in. So, what's environmental justice? Environmental justice acknowledges that even though all people are experiencing these things, the rich and the poor in France right now or in Spain right now are all experiencing wildfires. But if you have a car or you have transportation, you're able to escape the fire zone, you have an advantage over people who really cannot leave, or they are watching after animals. Perhaps they're farmers and their livelihood is there. So everybody's impacted a little differently. And that's where we get into equity and social justice. Depending on the job you have, the role that you have, your economic level, even your gender can impact how much you are affected by these various changes to our environment. So that brings us to planetary health. And I realize I went over the problems very quickly, but one of the beauties of planetary health is it's solutions focused. So let's talk about planetary health. First of all, I am going to acknowledge, and our second keynote speaker is going to be addressing this a lot. Humans once understood and had the principles and the values that allowed us to live in right relationship with the land, the water, the air. Some of us, if who perhaps are from some cultures, who began to split apart humans and nature, and they began to think of nature as separate from humans. And not only that, they began to think, okay, we're better than the rest of nature. We can do whatever we want with nature. We can use it up, we can destroy it, we can blow the tops off mountains, we can pollute the oceans, the rivers, the streams, the lakes. We can do whatever we want as long as it makes money for us. And that is the heart of the problem. We have bankrupted the future generations on the choices that we've made now. So I call attention to Indigenous peoples all over the world, especially in the Americas right now, who have a wealth of knowledge about how to be in right relationship. Planetary health is the big enough arch, the big enough umbrella to hold all these other fields. Public health, eco health, One Health, global health, the UN Sustainable Development Goals. So if those are areas you're working in, please continue to work in those spaces. We need good public health nurses. We need people working very hard on the UN Sustainable Development Goals. But we need you to link arms with all of these movements so that we can move the health of the planet and people forward. So, what is planetary health? This is the definition that the Planetary Health Alliance uses. Planetary health is a solutions oriented, which is great. It's not focused just on the problem. We're studying the solutions. Transdisciplinary, meaning it's not just health professionals, it's not just doctors and veterinary practitioners, which One Health is. It's everyone. It's dancers, artists, jurists, city planners, leaders of faith, children, elders. It's every single person. So it's transdisciplinary and it's a social movement. We analyze and address the human causes of this problem so that we can support all life on the planet, not just human life. This is about all the life. If you look at the planetary health diagram, it begins with our culture, our values and behaviors, which I mentioned that we think we're better than, driving this disruption of the nine planetary boundaries, causing these proximal causes such as air pollution, water pollution, quality, etc., that eventually lead to the symptoms or the problems, disease states in this red bubble. This is what gets modified depending on where you live, the quality of your housing, all of the items or factors that we consider social and structural determinants of health. So I have placed a blue star on all the places the nurses can get active. One is we can get active treating people who have problems, diseases, exacerbation of their conditions because of these ongoing planetary problems. Nurses in the public health space absolutely need to be working on social determinants. That in the policy space, we need to make sure that people have access to clean water, green space, etc. And then nurses are really, really good at being behavior change agents. So we need to move way upstream and look at the behaviors and the values, our patterns of consumption, our population, our technologies that have gotten us into this mess to begin with. So nurses have huge roles to play, nurses and midwives, in all those spaces. So I don't want any of you to feel left out. We do have a global shared language, and these items will be on the last slide with resources. These are offered through the Planetary Health Alliance, our big global organization. The Planetary Health Education Framework teaches all fields, all people, 5 core domains: interconnection within nature. Like the indigenous peoples have always understood, we're not separate from nature and we're not better than nature. We are nature. What you do to nature, you do to ourselves. It's absolutely essential that we get that mindset down and that understanding down, that all species, all animals, the plants, the water, the rocks, the air, are essentially part of our entire family. So interconnection within nature. The Anthropocene and health. These, as I said, are not normal problems. These are caused by humans. And the only way we're going to get out of this is to change human behavior. Equity and social justice. As I said, this disproportionately impacts some groups of people and not impact others. Might impact economic levels, but also pregnant women, children, elders, people who have vulnerable immune systems or vulnerable thermoregulatory mechanisms. So we need to be attentive to equity and social justice. Systems thinking and complexity. There isn't one field that's going to solve this. We all have to work together. So nurses can't just think, I'm only working with health professionals. I need to be able to work with farmers, engineers, lawyers, policymakers, leaders of faith. That needs to be my committee, my group of people that I work with. And finally, movement building and systems change. And Harriet is such a beautiful example of this, in that it's not enough to just see the problem, know the problem, but you get busy working on the problem. The second thing, so if we have a shared language now, we need to have a shared vision, and that's the Sao Paulo Declaration on Planetary Health. Where are we going? How do we work together? And what's the future we're co-creating? And this is the Sao Paulo Declaration's guidance for the health sector. That's us. This is our blueprint. We need to be working in these spaces. We need to become a health promotion focus, not just disease prevention or disease management. We need to be thinking in terms of public health. We need to incorporate healing perspectives from various different wisdom traditions and traditions such as led by Indigenous people. We need to have green spaces, adequate food, access to nutritious diets for all people, and advocate for health as a human right. So, what can nurses do? Well, we can go to the people. We are really good at getting out to where the people are. Lillian Wald, who was the founder of school nursing and public health nursing, described this. You don't stay behind closed walls, closed doors. You get out and you talk to everybody, be it at your child's little baseball game or a group of people at a faith in your faith community or your neighbors. Next Tuesday is National Night Out. I think I have 2 more weeks. Coordinate a gathering of your neighbors. Whatever you can do, gather people together. We can teach the people. This is a statement by Lillian Wald. Wald reform can only be accomplished only when attitudes are changed. So we need to be looking at those upstream drivers, those attitudes, behaviors, values that have gotten us in this jam. Greed, arrogance, thinking that you're better than another person. All of that has to be dealt with as part of nursing. We need to protect the people and be fierce about it. When I retired last year, people said, "What are you going to do?" And I said, "I'm supposed to be a fierce grandma." And you better believe that I'm a fierce grandma working for change to protect future generations. We need to advocate. Yes, being outspoken, writing op-eds, talking to policymakers is part of our role as nurses and midwives, because change will only occur if we show up and make sure that it's part of what people hear. As students, so I'm speaking to the students in the group, one of your most powerful tools is the Planetary Health report card. And that's where students get to give your college, your university, your nursing school a grade on how well they are doing. How well are they teaching planetary health research, planetary health content, and preparing you to be ready for the future that's coming. You better believe if you give your school a D or an F, they are going to start getting active. For those of you that are practicing nurses, early career nurses, there is all over the world, the Alliance of Nurses for Healthy Environments speaks to nurses on how do we preserve our environment. The Canadian Association of Nurses for the Environment is up in Canada. Annie, Latin America is down in the Latin American nations. So join that organization. And this is the quote I want to leave with you: how very little can be done under the spirit of fear. Nurses are people of hope, and people listen to us because they know we're honest, we're trustworthy, we're based in ethics, and we're hopeful people, and we're working for a positive future for all. Again, I have resources at the end. All of this will be available. Thank you very much.
Wow, thank you so much, Dr. Teddy Potter, especially and perhaps biased as a nurse, mentioning the role for nurses under planetary health and human causes of the problem, and to save and to save the lives of all and not just humans was absolutely incredible, and our interconnections of nature. Thank you so much, Dr. Teddy Potter. Thank you. Next on our panel, we have Dr. Melissa Vera discussing Indigenous knowledge and planetary health. Take it away, Dr. Vera.
Great. Thanks, everybody. Here, let me send the the article this is all based off of. So I'm going to be talking about something that's like a little bit older, but this is something that I will repeat over and over and over again because it's something that is a little bit more of the like the up here kind of thinking. And it was something that I did in 2022, 2021, and during my PhD program. So my name is Dr. Melissa Vera. I'm Tsimshian and Yaqui First Nations. I'm at Washington State University, the College of Nursing and the College of Medicine. And I just do a ton of work in Indigenous health and planetary health and like the intersections of them. And essentially it's like my career objective is to switch, not switch, but like just to influence the view of how we view Mother Earth, how we talk about Mother Earth and planetary health. And yeah, so here we go. Talk about it. So why an Indigenous perspective? Indigenous folks have a really unique view just inherently. And unfortunately, even in planetary health climate change spaces, the Indigenous voice isn't usually front and center. A lot of times we're not even invited to the table. But we offer a very holistic view of the earth, which all of us nurses on this call will completely understand. And that's why I love being a nurse. That's why I love talking to nurses about planetary health because I think we inherently understand this on a different level. That we're all like Teddy was. Thank you for the great introduction to like we are all nature. Nature is us, and there's a kind of a lack of the Indigenous view, and so this project was led by Dr. Nicole Redvers. She's up in Canada now, and she invited just a ton of First Nations people to get together and talk about what is like planetary health from an Indigenous perspective, because it looks different than some of the other things that have been out there in climate change narratives. But it's also extremely important because our viewpoints should be front and center. We should be leading with Indigenous view because at some point we were all Indigenous. We were all living our lives based on the cycles of the earth and Mother Earth and respecting that balance and respecting that relationship. And clearly we've come very far away from that viewpoint. And so it's up to us to help everybody kind of remember what that means. And so we ended up getting together and we had this viewpoint of like community is created wherever Native people are. And there were people from 7 different countries on this call. It was like right at the end of COVID. So, and we were like separated by quite a bit of different distance because it was 7 different countries. And we got together on a call to talk about this. And how we did it was research is ceremony. And we opened up in prayer. We were led by elders. We even had an elder calling in from the Amazon rainforest, which was really cool. And and it was also the first time as a research scientist learning all the Western ways at the University of Washington that I realized it could be done differently. I was like, what? We're opening up a focus group in prayer and we're like inciting our ancestors to join us. And now I really understand it on a whole new level. It's all I ever do now in my research. But it was really, really cool to have that kind of view just going into it. And we ended up having the elders be kind of our guiding light during the whole thing, including how we were going to disseminate this information. And they were there to guide us when some of the Western systems wanted to change the scary Mother Earth wording that we had. And the elders were like, absolutely not. Like, we've been invited to write this piece, and they, if they want this, if they want us out there and they want an Indigenous perspective, they're going to get a very Indigenous perspective. And it was really amazing to be guided by elders that way and our ancestors. And so we got on a couple of Zoom calls and just discussed what is planetary health, and we came up with essentially 10 domains that fell under these 3 interconnecting levels. And a lot of them are very interconnected as in a lot of things that we're going to even talk about with planetary health. Everything is connected in this web, even all the determinants, they kind of weave in and out of each other. And hence the spiral, it's like you kind of circle back into all these different things. And so the first one we talked about was ancestral personhood, legal personhood. This is the Whanganui River in New Zealand. It has designated legal personhood. So we talked about this as kind of a decolonial perspective of essentially a being on Mother Earth. And when you deny this right of being, it perpetuates climate change. It perpetuates the harm that we're causing on Mother Earth. And it create like actually having designated legal personhood to a river, for instance. This river can sue people who try to pollute her. That is such a big part of shifting the view of what is a being, what deserves the right to exist. And in Indigenous worldview, a lot of these beings, like mountains, are like in my tribe. I'll see something a little bit later about cedar. These are ancestors. These are beings that have helped us live and survive as humans on this earth with our more than human kin. The next is respect of the feminine. And with this one, we were talking about that women in Indigenous culture, we talked about the role of women, and we were tend to be the keepers of the knowledge and the caretakers of community, the caretakers of Mother Earth. And even in my tribe, the women were the reason why people survived through the winter because we would hunt salmon and gather berries and process the salmon for the entire tribe, and we would share with other tribes if there was surplus, and therefore like we are the nourishers of all life. And Mother Earth is like our primordial first mother, and she sustains us. The only reason why we are all alive on this planet right now is because Mother Earth and what she provides. So when you look at what is happening out there in the world to Mother Earth and the commodification of all of her bounty, it's no surprise that we see a lot of different issues going on with respect of women too. Violence against Mother Earth is violence against women and vice versa. And until we have like a centering and a respect for the feminine, for Mother Earth, for women who are the caretakers and the transmission of knowledge keepers, then we're always going to have issues with climate change and planetary health. That's all very much related. If you see Mother Earth as natural resources, you're never going to respect her enough to change the trajectory of climate change. She's our first and our last mother. She's all about creation, regeneration, relationship, collective vitality. And the way we treat Mother Earth is extremely important to any of the planetary health efforts that we're embarking upon in this group. So this is just kind of an example of what I mean by human interconnected with nature. I'll give you an example for my tribe. Cedar is everything. It's there for birth all the way to death. And it provides art, it provides housing, clothes, tools for hunting, tools for keeping. We would traditionally birth babies on a bed of cedar, like straw almost. And we would also be cremated and put back into cedar and raised as a totem pole. A lot of times that was actually like a ceremonial burial. And then we would let Mother Earth like disintegrate the cedar pole back into her. And so that's why like totem poles in general are considered beings or ancestors. There's usually actually maybe human remains inside them. So it's this part of like how we are actually part of nature. And even in climate change science, it's been proven more and more that humans are part of the environment. We are not necessarily supposed to actually leave it alone, even though that's a beautiful thing as well. But we've always been interacting with the environment and helping, and like prescribed burns. We used to burn things to help soil health and things like that. We used to interact with animals, with the forest, all the different things out there that created planetary health in this like cycle of life. was because humans were interconnected and part of it. And so I just wanted to highlight that with cedar. And until we really recognize this like ecologically bound cultural identity that we basically all have, then planetary health, it's part of planetary health is all I'm trying to say. Because anything other than recognizing that human interconnectedness is creating planetary harm. So Indigenous community in general is just collective by nature, and it's a whole worldview, this emphasis on interdependence with others, with land with a capital L. It's how we interact with each other, with all the different more than human kin. And this worldview helps maintain that balance and well-being for others in place. And like I said, these are all kind of related, but it's just like really remembering our place within that web and how we have always been interacting with all these different parts of Mother Earth, and that community and interdependence is so important. It's not something that's there for us and our health. And that's kind of the part that I like to talk about often in these like particular spaces of planetary health. It's not about human health and whether we're going to survive. It's whether everything is going to thrive. And it's not going to thrive if we keep thinking of ourselves as better than. So we talked about the modern scientific paradigm and the difference between like our science, aka Indigenous science, and like just like more traditional Western science lens. And this was an interesting picture I found. There was this white student in like a Western program, and there was an Indigenous professor that came in and talked and gave like a guest lecture about ocean health. And his mind was blown, and it was really cute and sweet, and I really loved it because he drew this picture with the class, and I was talking about the difference between Western science and Indigenous science. Western science tends to be very linear. We like to measure things and have validated instruments to do it, and all these like fancy schmancy words. And Indigenous science is very holistic, very well-rounded, and I kind of like to talk about it as like the longest longitudinal study in history, where we've had these observations of Mother Earth and our relationship within it. And that is our science. And that's what we bring forward into these spaces where it's like contextual. We have a lot of like metaphor, it's relational, it's not even really limited by time, it's collective. That a lot of times, even in grant cycles, what's your 5-year plan? And I'm like, well, I know the systems aren't made for us. We're talking about our 120-year plan. So I don't know how to even answer that question. But we definitely need both. I maybe people will hear something about two-eyed seeing, where you can see like kind of with both lenses. And I've always kind of joked that we only need like a tiny little pinky of Western science when it comes to climate change research at this point, because we're so far past some of our issues that we're having, that what like Dr. Potter was talking about. Like we've already surpassed a lot of these milestones. We're in a bad spot, and we know that. And so let's like really center these other ways of viewing Mother Earth. And yes, let's measure carbon in the atmosphere so we know exactly where we're at and things, but let's center this way of looking at the Earth. And we talked about governance and law, because the law defines how we interact with Mother Earth, right? Like GDP and what can we do in all these different spheres of life. This pictograph is a different article from Dr. Redvers, where we were talking about like natural laws or first laws. In Indigenous worldview is just essentially what are the laws governing Mother Earth. And then there's in that space is like Indigenous traditional knowledge, just like the things that we know as Indigenous folks passing down through millennia. And then but at the center is like healthy communities and ecosystems, and how how Indigenous people apply this to planetary health, and it just kind of, they all interplay with each other. But our laws just in general are based on unsustainable like development. It's all about growth, this like unsustainable growth that we talk about. That you need like 7 planets to continue the resources that people are using right now, which we don't have. So what are we going to do? And the first law is talking about responsibility. It centers love. People don't really talk about love in science, and it's actually really important to talk about that when we're talking about planetary health and climate change. Because if you have a great love and responsibility for Mother Earth, like it's going to just change how we do things and how we see things. It prioritizes the rights of all relatives on Mother Earth, and nobody's above anybody else. And this is part of the Indigenous people's part. And we already talked about this from Dr. Potter's lecture. 80% of the world's biodiversity is taken care of by 5% of Indigenous population, or 5% of the population, which are Indigenous folks. And with that, like these land tenure rights are under continuous threat. And these rights guarantee the protection and the conservation of these systems that we've already been able to preserve this long. And so being able to maintain land tenure rights or even increase land tenure rights would be really optimal for planetary health. The land back movement isn't always necessarily about giving back all the actual literal land, but it's more about how Indigenous folks should be consulted in these like conservation efforts and stewardship of our natural resources. Like, no, how are we going to give land back? How are we going to have a reciprocal relationship with land, and land with a capital L? Like, this is our place. This is our home. How do we treat it? And it should be led by Indigenous folks. So we talked about Indigenous language. There's 6,700 languages spoken worldwide, 4,000 by Indigenous people. And essentially that number is off because one Indigenous language dies every 2 weeks, apparently. And that does track in my tribe. There's only 6 people that were born speaking our language, and they're all very, very old at this point. And so we have all these efforts to try to conserve our language. But this loss of language is like a loss of extensive ecological knowledge. So we talked about how language is really actually very important to planetary health and how we go forward with our knowledge and transmitting our knowledge. And thank you. I'm almost done with this. And then not the last one, but second to last one is the well-being of Indigenous people. So the well-being of Indigenous people directly linked to the health of the planet. So we talked about this definitely as a determinant of planetary health for all the reasons above that I've stated. Indigenous people know these things. We're trying to help everybody remember these things. We should be leaders of these things. We should also have the health to be able to move on land and help protect and conserve what we have left. And if you have a population of Indigenous folks who are sick or can't even like feed their family, then they're not out there protecting Mother Earth for everybody. And it would behoove us all that Indigenous people are as healthy as we can be and have access to our culture, access to our land, so that we can stand up for what's right and protect these things that are like, you can't get a river back if you destroy it. And so if we prioritize Indigenous health, it actually helps the planet and helps everybody involved. And the last one was one of my favorites because we talked about home is essentially conceived as all these relationships that connect someone to everything else that's around them. It includes your ancestors, it includes your grandparents, it includes the children. So the grandparents and the elders are like the transmission, or they're the knowledge holders, and they transmit it to the next generation. And the next generation, they're the ones that get to learn all of this and add to it. And kind of like I was talking about the 120-year plan, we think about with our actions, we consult with our ancestors, and we think about the future generations ahead. And it seems so simple, right? But it's not very simple in this society that we live in to think that way when you're talking about planetary health and any of the efforts that we're doing or anything that we do with Mother Earth. Like, are we thinking about it in this way at the 7 generations before and after? Or what are we leaving in our wake? So elders are the foundation and children are the future. And so we have to keep that in mind as we go forward in our planetary health efforts. And so I will end with, first of all of my co-authors. It's just the gift that keeps on giving. I love this group of people. I love this piece that we put out there. I put it in the chat. You guys can check it out yourself. Here are all the lands that we come from. And I really appreciate your time. Like I said, I love hanging out with nurses on calls and talking about this because you all understand it. It's not rocket science because we all look at things holistically. So hopefully you can go forward and start talking about weird things like Mother Earth as you go forward. Thank you.
Thank you so much, Dr. Vera. Just incredible, very inspiring work. Congratulations, and thank you for presenting with us today. Next, in to save us some time, we have a panel discussion with voices from across the Americas with Lucy Brown and our panelists, Kara Cook, Dr. Catherine Kruger, Mia McPherson, and Dr. Sue Ann Bell. Lucy, take it away.
Thank you, Stephanie, and a huge thank you, Melissa and Teddy, of incredibly inspiring talks already. So, and it's wonderful what an impressive and stellar panel I have to interview now. So thank you to everyone that's joining us and everyone on the call as well. Please do feel free to pop some questions in the chat as well. We'll try our best to squeeze them in. If not, we can follow up with some questions too. So I've got a few questions to ask this esteemed panel. And if you'd be kind enough, my fellow panelists, if you could just briefly introduce yourselves when you answer the questions, that would be wonderful. Gives people some insights of your background. So Teddy touched on it earlier on. She talked about how environmental change does not affect everyone equally. And from your experience, what are some of the biggest environmental justice challenge or injustice challenge facing our communities, particularly across the Americas where you're based today? So I might come to Kat first. Catherine, if that's okay, you're happy to step up first?
Sure. Hi, everyone. I'm Kat Kruger. I'm a national clinician scholar and a research fellow at the University of Michigan School of Nursing. And my research really focuses on building resilient health systems as well as health workforces in the face of climate change and disasters. So some of the biggest health equity challenges that we see in our region have been like front page news all summer long. We had huge and devastating heat waves. Not just us, but of course in Europe as well. And then tons of wildfires that have been really impactful for Michigan and air quality. And I still work in the emergency department, so I see that firsthand with COPD exacerbations, asthma exacerbations. And those are, of course, affecting the people who don't have air conditioning and can't get away and don't have other options.
Really good summary, Kat. I might come to Cara next. From your perspective, it'd be wonderful to see how you see this kind of impacting the communities that you work with across America, across the Americas.
Yeah, absolutely. And hi, everyone. It's great to be here with you all. I am Kara Cook. I am a nurse and deputy director with the Alliance of Nurses for Healthy Environments. I think some of the biggest issues that we're seeing in the Americas, particularly in the United States, is the kind of historical legacy pollution that communities have been dealing with that really have been built up in terms of industry, manufacturing, military bases, and these tend to be in communities that are low income and communities of color that also are having compounding challenges, whether it be social, economic, or political challenges. And so you have the environmental determinants of health that mix in with the economic and social determinants of health. And then I'll just also mention, which is really prominent globally, but also in the US, is just the rapid build out of data centers, which are creating huge environmental justice challenges for communities.
Yeah, good point there, Cara. And actually, I think we're seeing that now across Europe as well. And that's an interesting documentary actually recently on that. So thank you. Thank you for those insights. Really, really helpful. So in the interest of time, I'm just going to move across to the next question. And Teddy mentioned Florence Nightingale, who's one of my heroes as well. And interesting enough, this relates kind of to nursing midwifery practice. Interesting, Florence wrote more about the environment and the connectedness to health than anything else. And we seem to have lost it along the way. So this next question really resonates with me. So what role can nurses and midwives play in addressing this environmental injustice, whether that's through clinical practice, education, research, or advocacy? So I might come to you next, Sue-Ann, if that's okay with your background.
Sure. Thank you for that question. I think, as nurses, we treat patients in the hospital, we treat patients in home health, we treat patients in the emergency department. But one of the unique skills we bring is understanding the context of the conditions that people live in, where, what their house is like, what their job is like, what resources they have. And I think that's an important skill for nurses to always remember, is that when we're thinking about COPD right now, with all of the wildfires we're having in the US particularly, we also have to think about what kind of resources do they have to address those the effects of their chronic conditions. And as nurses, we have those skills to support people and to bring answers that aren't just about treating the immediate illness. I think that's a super important role of nurses. So we're not just providers treating them, we're also advocates for their better quality of life.
A very good answer. Thanks, Sue-Ann, brilliant insights. And Mia, are you happy to give us some insights into what nurses and midwives can do?
Hi, everyone. My name is Mia McPherson. I'm also calling in from the state of Michigan. I would like to add that the role that nurses and midwives can play is just organizing in their own individual communities. I always encourage nurses to start where they are with what they have.
Advice.
So that looks like organizing within your workplace, within your neighborhood, your religious organizations, and gathering folks who are already like-minded, and also gathering folks that may have a curiosity about how climate disasters and climate change affects their health and their communities, but maybe they don't know enough about it, or maybe they don't know how to get involved. Gather up as many people as you can, meet people where they are, and start with what you have, because I think that individually we can all come together to make very, very strong collective and powerful movements.
Oh, Mia, that was absolutely inspiring response, and so true, isn't it? Start with those small changes will add up to a big impact. So thank you so much for your insights. Next question. So this leads on quite nicely, actually. Thank you. For someone just starting out in their career, and I've seen some questions in the chat as well. What are some practical ways in which we can get involved in environmental justice without feeling overwhelmed? So I might come back to you, Mia, if that's okay. Thank you.
Yeah, absolutely. Thank you, Lucy. So I've been a nurse for just 5 years now. So I'm happy to answer this question. And a few of the notes that I wrote when I was thinking about this panel and this webinar, practical ways, as I previously stated, is start where you are with what you have, with who is around you, but also identify what your fundamental principles are and be rooted in that. So for me, my fundamental principles are justice, equity, love, community, anti-racism, anti-capitalism, and that is what continues to fuel me. What fuels my curiosity. That's what really fuels me to do the work that I'm doing. I also would like to encourage folks that they don't have to be an expert. You just have to care. And I know that sounds cliche, but it's the truth. You don't have to have a certain degree. You don't have to have a certain work experience. You don't have to be on 30 different organizations. Just be yourself and show up fully with, just the mindset that I'm going to give what I have, and, it'll all come together and be very powerful. I also would encourage self-reflection. So, what are you willing to sacrifice? That could be your time, money, energy, personal freedoms, and certain relationships. You have to ask yourself, what do you have to lose? what do you have to gain? And often when I ask myself those questions, what I have to lose by not engaging and by not contributing to planetary health movements is I feel like I lose a piece of myself. I lose something that I deeply value, and that is the contribution that I have to my community. And the last thing is to maintain a sustainable pace. This is a fight of a lifetime. So don't burn yourself out. Don't feel like you have to do everything and be everything. Do what you can, show up authentically, believe in yourself and believe in those around you and believe in the movements, because we have so much more power than um, kind of our challengers, for lack of better words. We have a lot more power than our challengers would like for us to believe that we do. So never be disempowered. Always believe in the ability for us to fight off powerlessness and fight off those feelings of being dispirited. Just know that we can truly overcome so much, and look back at the giants that you're standing on. Look at those shoulders that you're standing on, and all the things that they've had to overcome are situations that we can't even imagine. So, you know, we're going to be the next generation. They're going to look back at us and say, you know, they overcame so much and they were able to accomplish so much. So just always keep that perspective in mind. Know your power, lead with love, and believe in yourself.
Wow.
Thank you.
Mia, that was incredible and so well said. But well, Sue-Ann picked up on it as well. You don't have to be an expert, you just have to care. And that's exactly what nurses and midwives have. I think if you cut us open, as we do have to care. And I really do believe we can lead the change we need to see. And Mia, I think you're quite rightly the future of nursing right here. I don't know if everyone else agrees. Thank you so much. Thank you. Lead with love. I love it. Great. I've got one final question for the panel before I hand across back to Stephanie. Despite the diversity of the Americas, many countries face similar planetary health challenges. I think we've kind of touched on that, haven't we, through some of the questions we've already answered. What opportunities do you see for collaboration and shared learning across the region? So I might come back to you, Cara, first, if that's okay.
Yeah, absolutely. And this is a great question. I think you know, a lot of the solutions to environmental justice issues are found and led by communities most impacted. And every community is different, but that doesn't mean there can't be shared learning around the interventions and the kind of, I guess, for lack of a better word, the battles are kind of up against in addressing these issues. And so I think, you know, there's not one size fits all solutions, but there is so much overlap in learning that we can have across organizations and communities. And I do think there is a real importance in unity and collaboration because, you know, as Mia was saying, we are stronger together. And if we're addressing the same things in terms of planetary health challenges. And so, you know, the Americas has a lot to learn from Africa, Europe, you know, all around the world. And so I think as we're collaborating as nurses, as a profession that touches all parts of the world, it's a really opportune moment for us to be learning amongst each other and working on environmental health challenges together.
Cara, well said. And I think this webinar series is a true reflection of that as well, isn't it? Us all coming together to share expertise. Just going to come to Sue-Ann next, if that's okay, just to answer that final question. And then I'll hand across back to you, Stephanie, if that's okay. So just to you finally, Sue-Ann.
Sure. The same question you had for Cara.
Yeah. So just how do you see the collaboration, really? Because I know we've worked together on a few things. So
Sure. You know, I think you know, I've worked with Lucy on some things. I've worked with Cara on a number of things. I work with Kat all the time. I would love, Dr. Vera, I would love to be able to work with you. And I think when we come together in meetings like this and we're sharing ideas and sharing what definitely stuck out to me about this talk today is how much we learn in our basic nursing classes, that nursing is an art and a science. And I think in talks like this, that really shows through. And I think that's where those connections can take place and collaborations can build outside of just research and writing papers, but really that we have a shared set of ideals.
Absolutely. Thank you. Oh, sad to say that our panel discussion's now over, but thank you to each and every one of you. I admire you hugely, and it feels a great honour to be able to moderate this discussion this afternoon. Please do, I think there's a few questions in the chat. We'll do our best to answer those, but I'm going to hand back to Stephanie now, just so she can wrap us up. Thanks ever so much.
Wow. I know the rest of our audience is completely speechless and probably dying to ask y'all questions. So impressed by your knowledge, your experience. It is, I am totally speechless. I see one question in the chat, and then I know we are close to that time. But how do we remain hopeful for the future? And I think you all touched upon that, but if someone wants to give us some quick parting words.
I don't mind going first. I hand across perhaps across the others, but I guess moments like this fill my heart with joy and realise collectively what we can achieve together. And you're going to have down days, you're going to feel overwhelmed, but pick yourself up and keep going, because nurses have demonstrated quite rightly here have phenomenal values and deeply care about people and the environment. So if we keep going, we keep influencing all those around us, we can really make the change we need to see. Might go to Cara and Sue Ann and Kat. I don't know if there's something you want to quickly share as well.
I can share. I'm just reminded about Joanna Macy and how she talks about active hope and the importance of acting, even if you don't know the outcome or if you aren't hopeful, because there's a lot of times I don't feel hopeful, but I see all the people around me who are continuing to act in that unknown, and that continues to drive me. And I think, I have to do something. And so I just keep moving, take it day by day.
Great advice, Cara. And Sue Ann, to you.
I would say one thing that helps me not feel overwhelmed is to try to keep focused on, that I don't have to do everything or be involved in everything, but to try to pick one thing that I can, give my energy and passion to, and to support others who are working in other areas as well. I think it's easy to get overwhelmed, but focusing on, maybe that core mission or one individual thing that you can accomplish.
Thank you so much. To close us out, because we are at time, unfortunately. I wish that we can be here forever. It sounds like we'd be here for hours, and that's probably what we should consider in the future, having a whole conference perhaps. But I just wanted to thank you to our speakers, our panelists, and everyone who joined this conversation today. Today has reminded us that planetary health, justice, Indigenous knowledge are inseparable from health equity. As nurses and midwives, we can carry these lessons forward by listening to communities, honoring Indigenous leadership and sovereignty, and advocating for healthier, more just futures for people and the planet. Thank you so much, everyone, for today. And we are so honored to continuing to collaborate. Absolutely. Thank you so much.